Hey everyone, we're going to get started in just a few minutes. So we're just letting a few more people in. So I hope you're excited as we are to do today's episode of Allergy Insider. We're definitely going to have a fun conversation and hopefully, talk about a lot of things that are either bothering people right now or are going to be in the next couple of months with spring pollen season coming. So it looks like we've definitely got some people joining. As I said, we'll get started in a minute, but you should start thinking if you have any questions, about kind of rhinitis symptoms, right? Stuffy noses, runny noses, those really irritating symptoms like, cough, sneezing, runny noses that people get either seasonally or have all the time. Start thinking about them because we're going to want you to put them into the chat, and we'll hopefully get to as many as we can before we wrap things up today. All right, so you know what? Let's get started. Hello, everyone, and thank you so much for tuning in today, joining us for our next episode of Ask the Insider. Today's episode is known Inside Allergic versus Non-allergic Rhinitis. I'm your host, otherwise known as the Insider. My name is Gary Falcetano. I've been a PA for over 25 years with in practicing in primary care, emergency medicine, and allergy and immunology. Currently the U.S. Clinical Affairs Manager for Allergy at Thermo Fisher Scientific. I do have a couple of my colleagues joining me today, the one you see next to me and one that we don't see, and that's Luke. He's behind the camera today, and he's going to be keeping us honest and making sure everything works well. As I mentioned before, if you have some questions, please, we want to answer them, so put them in the chat, in the comments, and Luke will call them out during our Q&A live session a little bit later. Today, we're actually live from the Quad AI, and you're probably wondering, what's the Quad AI? Well, it's the American Academy of Allergy, Asthma, and Immunology. So we're at their annual meeting. It's being held in beautiful downtown Phoenix, Arizona. And we're here with a lot of our colleagues, and there's all kinds of science and informative sessions going on. We're actually in one of the session rooms that's not being used right now. But joining me in front of the camera is this fellow here. This is Scott Duhaime. Scott knows just about everything you'd want to know about rhinitis. I might say Scott knows snot, but maybe I shouldn't say that. Yeah. But Scott, all kidding aside, why don't you tell us a little bit about yourself, and
Sure.
then we'll get to the topic at hand.
All right. Well, thanks, Gary, and hello everybody from Phoenix. And I guess to say that I know snot, I guess a better way to say that is I'm intimately familiar with snot. So all that to say, I should tell you about who I am. As Gary said, my name is Scott Duhaime, and I've been seeing patients for about 25 years as well. And that time has been divided up between a 20-year career in the military, but also a time with the University of Texas Health Science Center in San Antonio, which is the medical school where I was a faculty associate in the Department of Otolaryngology, which is just a big word for ENT, ear, nose, and throat. But for the past 6 years, I've been on the Medical and Scientific Affairs team with Thermo Fisher Scientific.
Awesome. Well, thank you. I'm really excited to have you with us.
I'm excited to be here. Real excited to be here.
So, the topic, as I said before, is allergic versus non-allergic rhinitis, right? Mm-hmm. But the real question is, people, I think, a lot are frustrated because sometimes their allergy medicines don't work. They're taking antihistamines, they're still having symptoms, and we've both seen patients like this that come into the office and they want some help, and so. Take us through allergic versus non-allergic rhinitis, and also what is rhinitis?
Yeah, absolutely. So, and it's a great question, and it's a question that I get quite often when I'm having this discussion with patients. And what happens is I usually try to back it up to describe just what you said. What is rhinitis? And rhinitis is just a big $10 word for inflammation of the nasal passages, and that's in the front of your nose as well as all the way to the back. And that inflammation can cause those symptoms that we commonly think about when we're talking about upper respiratory symptoms. And that could be congestion, that could be runny nose into the back where it's causing you to cough and clear your throat, as well as sneezing, and anything that affects this whole area up here. And of those patients who have rhinitis, and when I'm talking to patients about rhinitis, there are really two groups of patients that can cause, two groups of offenders that can cause those symptoms. There's the allergic rhinitis patient. Those are patients who have allergies.
Yep.
And then the non-allergic.
I think that's who people think about, right?
Yep, absolutely.
If you have all these symptoms, and especially if it's happening this time of year, you think it's allergic. But
Yep.
I'm sorry, I cut you off there.
No.
So you were saying there's allergic,
Yep.
and then there's non-allergic.
And then there's non-allergic, absolutely. And on the non-allergic side, you have some common causes of non-allergic rhinitis, and then you have some uncommon reasons to have non-allergic rhinitis.
All
And the
right.
common ones are, I can give you just a couple of those.
Take us through the non-allergic, right? We'll come back.
Yeah,
I promise
sure.
we'll come back to the allergic rhinitis.
Yeah.
But take us through these common and maybe a couple of the uncommon causes of this non-allergic rhinitis, because it's important because I think it helps people realize
Yeah.
what's driving their symptoms.
Absolutely, absolutely. So when you think about, again, here's allergic rhinitis and non-allergic rhinitis. On that non-allergic rhinitis side, those common causes can be things like you would think of like infections, whether that be viral or bacterial infections, as well as occupational reasons, meaning you're at work or maybe you have workers in your home and there's dyes or fumes that are being rising up from your occupation, and those can cause those same symptoms, as well as reflexive. You can do something like eat food, and certain types of food can cause a reflex, and that can cause the same symptoms of rhinitis that you would see with the allergic rhinitis.
So that's funny. I mean, I'm one of those people, right? When I eat some foods, sometimes
Yeah.
spicy, but sometimes not.
Yeah.
All of a sudden, I'm getting congested. My nose is running, especially with the hot foods. But even so, with not hot foods, but that's not an allergy, right?
That's not an allergy, right? Exactly. It's not an allergy, and it's important to make that distinction, because if you're going to be taking it over the counter, or somebody gives you a prescription for an antihistamine, the antihistamines are only going to work on the allergic rhinitis side.
That's an
they're
important
not gonna,
point,
Yeah, they're
right?
not going to work on the non-allergic side.
So that could be the reason why people are coming in miserable. They're on the antihistamines.
Yep.
They're maybe even taking them like they shouldn't be taking them to try to get relief, and they're just not getting it.
Absolutely, absolutely.
Gotcha.
Yep.
So, one of the other uncommon causes, I think, is people don't know. I think very few people know this, is medications.
Yeah, absolutely. So a moment ago, I described to you what some of the common reasons for the non-allergic rhinitis, and then there's some uncommon reasons that are a little bit more rare, but nonetheless they're out there. And one of them is medications, and those medications can be something that you take over the counter, as well as those medications could be prescription medications. Over the counter ones, there's things you would think of like ibuprofen. Some patients can have a reaction to that is causing rhinitis symptoms, but it's not an allergic rhinitis. And some of the prescription meds that we think of are things like erectile dysfunction medications. Those can cause, and other ones as well, that can cause the same rhinitis symptoms.
That's really interesting. We're getting a lot of feedback from everybody out there.
Oh, good.
Yeah, my daughter says hi, so we got to say hi to my daughter. Make sure that we send out some love.
No, good.
But okay, so we talked about these now the common uncommon causes. Sometimes there's things we can do, right? If it's a cold, right, the viral illness, we kind of get through it. There are some medications we can take for that.
Yep.
It's sometimes nasal sprays, that type of thing.
Yep.
But if there's hormonal as well. So
Yes.
you know what? Before we go to allergic, I want to hear a little more about hormonal rhinitis.
Absolutely. So hormones can change in patients, particularly women, where if you're pregnant or if you're on oral contraceptives, sometimes that can change your hormones, and it can result in a reaction where you start having rhinitis symptoms. And on top of that, there are hormonal diseases that cause hormone changes, like hypothyroid. Same situation. The hormones change, and those patients can sometimes also get rhinitis symptoms the same way.
So in that case, if it's because you're pregnant, well, you're going to have the baby and resolve that.
Right.
But if it's other disorders like hypothyroidism, we treat those, right?
Absolutely.
So we treat the cause.
Right, absolutely.
And so not just throw medications at the symptom.
Yeah, right, absolutely. Yeah, you really, the best thing, the number one treatment for any kind of rhinitis, the number one treatment is going to be finding out what the diagnosis is, which camp you're in, allergic versus non-allergic, determining that, and then avoiding whatever the inciting substance happens to be. That's the number one treatment.
Okay, so we looked at non-allergic, and then you took us down some of the diagnostic
Yep.
possibilities for non-allergic,
Yep.
and then there's always associated treatments for those. Now let's move over to the allergic side of things.
Absolutely, yes.
Right? we need, number one, find out that we are allergic, right?
Yes, absolutely.
And then
Yeah.
once we do that, we want to find out what we're allergic to, I would assume, right?
Yep.
And then from there, right, we know that things like antihistamines, nasal sprays, nasal steroids will work. But we want to get to, you said you want to get to the underlying. Right?
Absolutely.
What's driving the process?
Yeah, absolutely. And really, if you go back up to the top where we talked about rhinitis, you're coming in to see me or Gary, or you're coming in to see your primary care provider, and the first thing that person has to figure out is which camp you're in. Are you in the allergic side, or are you in the non-allergic side? And usually that's done through some testing, and that testing is widely available, and the testing will tell us not only that you're allergic, but it will tell us what you're allergic to. And then when you can give the patient, the information of what you're allergic to, we're arming you to be able to take participation in your disease state, because then you can find out where you're being exposed to that particular thing and find out how to mitigate that and reduce that amount of exposure.
All right, so now let's break that down. So
Absolutely, yeah.
there's inside allergens, right? There's things that we find in our homes and businesses and schools.
Yeah.
And then there's outside allergens, things that I think most of us think of, right? Like the pollens, tree pollen, grass pollens, weeds, ragweed. We hear about ragweed season. Hay fever is the other name for this, right? So once we've identified what specifically we're allergic to, so inside, what are some inside allergens?
Yeah, great question. So as you described, some of the outdoor allergens, but keep in mind, you can take those outdoor allergens, the weeds, trees, and grasses, and then they can get on our clothes or get on our animals, and they can bring them into our homes. So you need to keep that. You need to keep that in mind too. But on top of that, there are not seasonal but perennial allergens that are always in our homes or in our places of work that are there year round. And those can include anything from our animals, the dander that's on our cats, on our dogs, but also the animals that you don't always think about. Most folks think of cat and dog, but there's also guinea pigs or parrots or ferrets or any of these exotic animals that not everybody has. But a patient can be allergic to those as well inside the home. And on top of that, other things in the home that people think of is dust mites. That's another one.
That's pretty common, right?
Yeah, it really, really is. And I probably should say a little bit more about what dust mites are, because I get this question quite a bit. I get a question of, well, is dust mites the same as dust? Is that the same thing? And the short answer to that is no. Dust is just a particulate. Dust that you have in your home is a particulate just like any other particulate could be, like even fine sand or pepper or anything else. And that is a non-allergic cause of rhinitis, dust. And it'd be the equivalent if I went to your pantry and I put some pepper in my hand and I blew it into your face. You'll start sneezing and you'll back up and you'll get some rhinitis symptoms.
But that's an irritation, right?
That's an irritation.
Not an allergy.
Absolutely. Okay. It's just an irritation.
But a dust mite is something different.
A dust mite is something different. A dust mite is a let me say that it's a microscopic creature that lives on our porous surfaces, like our mattresses, our pillows, or our stuffed animals for our children, or pillows on the couch. And the way I usually explain that to patients is to say, let's say that I went out and purchased a new pillow, or I purchased a new mattress, and I brought it home and I weighed that pillow or that mattress. It's going to weigh.
This is going to be gross now. I can tell where you're going.
I know. So, and I weighed it, and then I went and slept on that pillow and that mattress for 5 years, and then I weighed it again. The initial weight and the weight after 5 years of sleeping on it is going to be different. And I know that's not a pleasant thing to talk about.
What the dust mites have all been discharging over the past 5 years.
Absolutely.
Right?
So it's not necessarily the dust mite. It's the dust mite products, and I'll let you describe
and
what that means.
people obviously become allergic to those, become allergic to those.
Those proteins that the dust mites let off, you can be allergic to that, and then have those symptoms.
I want to talk more about some of the other things in the house that you can be allergic to. But before we do that, right? One of the things when I talk to clinicians and I'm talking about allergy, right? We call allergy a threshold disease, right? So the allergens, if you're allergic, you're usually allergic to more than one thing. If you're an allergic person, right?
That's true. Yeah.
And they climb on each other's backs, right? To add up to really make symptoms worse. So explain a little bit about that.
Yeah, absolutely. So if you have a patient who is allergic to, let's say, 3 different things, Let's just out of the blue. It could be 6, it could be 8, whatever the number is. But let's say they're allergic to 3 different things. And they have a level, if you can kind of picture it like a floor. And if you have that allergy to that bottom level, let's say that's to the cat dander. And let's say that you're also allergic to the dust mites. That adds the level up a little bit more. And then let's say a third thing that goes in there, let's say some pollen that happens to be that you're bringing in from the outside. Now your level is about that much. Well, whenever that pollen gets a little bit spiky because it happens to be pollinating at that particular time, it's going to raise up. And once it raises up, what happens is now you are reaching over a threshold, and that threshold is causing you to reach for your allergy medications.
This is when you're all those symptoms you talked about, right?
Absolutely,
This is when the snot is going.
Absolutely, all
high.
that congestion,
Yep.
all that rhinorrhea or that snot, whether it's coming in the back or in the front, and that sneezing, that threshold is met by adding up all of those things that you're allergic to and causing that inflammation in your nasal airway.
So the point is, we've got all these symptoms, and we want to do something about it, right?
Yeah.
So, people are taking their antihistamines,
Yeah.
right? But they're not getting relief, even if they are allergic, right? They may be getting partial relief,
Yeah,
right?
yeah,
How
sure.
can we make those medications more efficacious?
Yeah, absolutely. And that's what I was saying a moment ago, that really the number one treatment for allergies is going to be avoidance. So in that scenario I just gave, where the patient is allergic to the dust mites as well as the say, cat dander and the pollen, you need to reduce your exposure to that, because that's the number one treatment.
Gotcha.
Now on the other side, and that's where the antihistamines don't work at all. And those patients come in and say, I've been to Walgreens or I've been to CVS and I've been taking all of these antihistamines, but they're not working. That's where you need to make that determination. Well, probably you're in the wrong camp, because the antihistamines are only going to work for the allergy cause, the allergic rhinitis.
So we don't want to do a physiology class, but explain what happens, right, in the nose,
Yeah.
when you're allergic, right? The allergen causes it triggers a release of histamine.
Of histamine, absolutely. And then that histamine and some other mediators too, other chemicals that are in there, but histamine's the big one. And that one goes over to your actual nasal mucosa and dilates it. And once it dilates, it gets puffy in there and it gets inflamed, and then it allows all the
starts to leak,
secretions to
right?
come out. Yeah. So those antihistamines are only going to work on the allergy side. They're not going to work on that whole other camp that we talked about, the non-allergic rhinitis camp.
All right. So, okay, let's get back to things like dust mites, things like pets.
Yeah.
These inside, right? If we're allergic to things inside, we want to try to reduce their levels.
Yes,
right?
absolutely.
So just real quickly, what can you do at home to reduce your levels of dust mites?
Dust mites. Okay, so on dust mites, some of the important interventions that somebody could do is obviously dust, because the dust mites are going to be on the non-porous surfaces. But really, the number one thing that most folks think about, and that's going to be dust mite covers. I'm sure you've heard of those, and they're not that expensive, and they're not they're the technology that's gone into the dust mite covers, and those go encasing around your pillow and encasing around your mattresses. The technology that's gone into developing those over the past 10, 15 years has gotten much better, and the cost has really come down quite a bit.
They've gotten cheaper as well.
And they're real important, because what will happen is the dust mite will not be able to come out of the actual mattress itself to feed at night on our dead skin cells,
Or
not
get
so
any
good.
new
Or
dust
get any new
mites
ones
or
in,
their
right.
materials right into
Absolutely.
the mattress.
Yep.
And that way, when you wash your sheets, which we probably need to do more than we do.
We
right?
do,
Maybe
absolutely.
at least once a week.
And in very hot temperatures, yes, to kill the existing dust mites.
So
yes.
that way we've got this kind of clean surface we're sleeping on. We're not sleeping with our dust mite friends.
Yes,
right?
absolutely.
And just kind of laying in there and having the symptoms.
Yep,
right.
absolutely.
And then what about outside? So we said the number one thing people think about are pollens, tree pollens, grass pollens.
Yeah, sure. Yeah.
So we can't put people in a bubble.
You can't put them in a bubble, and you also can't go cut all the trees down, and you can't get rid of all the grass and all the other things.
Sometimes I think we're trying.
I know. Yeah, you can't do those things because we have to live in the world. But knowledge is power, and if I know what it is I'm allergic to specifically, then I can watch the news at night and I can see the pollen count for this, the pollen count for that. Or you can get on some websites that are available out there, and you can punch in what your zip code is, and it will allow you to be able to determine what's heavy in your particular area for the weeds, trees, and grasses. And once I know that, once I know what it is, and I know when it's going to be elevated, I'll want to make sure that I take some medications prior to that, and those can be prescription or over the counter, as well as make sure I'm not outside as much during those times. And the third thing is, if I am outside and then I do come back into the house, I don't want to take those pollens with me into my home.
So one of the things, that I often talk about is, especially, with children, right? They're outside playing. They're allergic to pollen, right? They've taken their medications, but now they go in the house, right? They don't look like us, right? They actually have hair on their heads. So they take this hair and they don't shower,
right?
And they go to bed and they just sleep with the pollen right there at their face, right? So if you're allergic to stuff that's outside, keep it outside.
Keep it outside.
Change your clothes, wash your hair, right?
And the other thing would be, if you do, let's say you have a dog, and the dog, you may not be allergic to your dog, but if the dog goes outside to take a break, go to the bathroom outside, then when that dog comes back in, if it's a heavy pollen season that are triggers for you or for your loved ones, then you want to make sure you wipe the dog down and keep all of that pollen off the dog, because the dog's going to come in and sit on the couch, or going to sit on your bed or the child's bed, and you want to make sure that's not transferred into your home.
All right. So I think we've done a pretty good job of differentiating, right? Allergic versus non-allergic. Some of the common triggers for non-allergic, some of the common triggers for allergic. Why antihistamines don't work, right? Why we're miserable sometimes, and we can't figure out, hey, I see all these commercials for this drug and it's not working, right? So just briefly, just review that whole non-allergic, allergic one more time, the common triggers for each, and then, really what we can do to figure it out. What we're, number one, if we're allergic, or not, and then number two, either way, how we figure out what the specific things are that driving the symptoms.
And that's really the take-home message. The take-home message would be that we know that the rhinitis, what I described earlier, inflammation in your nasal airway, we know that's going to cause symptoms that are very common, in today's world. And we know that there's a camp over here, the allergic rhinitis camp. And then there's the non-allergic rhinitis camp. That allergic rhinitis camp over here respond well to antihistamines, but also respond to avoidance once you know what it is you're allergic to. Now, how do you determine which camp you're in? The only way to determine which camp you're in is through some testing, as I mentioned a moment ago. You got to be able to do some testing, which is available at your primary care, and they'll be able to do that testing for you and determine are you allergic or not, and what you're allergic to specifically.
And so I would add, right? There are various types of testing. There's skin testing that can be done by an allergist, since we're at the Quad AI, and there's a whole lot of allergists here. They certainly can do the testing, but they can also do blood testing.
Blood testing.
But you mentioned it's also available at primary care offices, so you can get a blood test for your allergies and get that information very easily today, and really get the same information that was only available by going to an allergist years ago.
Absolutely.
So that way we can take care of more and more people and get them the help and the really information they need to attack those allergic versus non-allergic and what to do about it.
Absolutely.
So I could talk about snot all day with you, Scott, but I think we need to wrap things up. So I'm going to look back at our colleague Luke there behind the camera, and Luke, what kind of questions are coming in? Because we need to answer at least a few questions before we wrap up.
So we had one question about what to do about grass pollen if avoidance is the number one treatment. You touched on that a bit, but maybe go a little further on, let's say, like indoor animals a little more, about avoidance in that sense. So.
Okay. So avoidance of for your indoor animals. Well, there's a certain amount of bathing that you can do for the animal, but it's not going to make it completely go away. The number one thing to do is to determine, are you truly allergic to that particular animal? Because patients can think, well, I'm allergic to the animal, but they've never been tested, so they don't know it specifically. But once they do know what that is, then there's some things you can do as far as making sure that animal is not necessarily sequestered, but keep that animal out of the bedroom where you're sleeping. keep them off the beds, that sort of thing, and frequently, and again, just bathing the animal. And I think
So,
anything else? Or?
so I mean, the old advice, and actually the number one advice, right, is to get rid of the animal. We're not doing that.
No.
You know, my dogs are probably watching that. We are not getting rid of the animal. But, you know, as you said, Scott, you know, incrementally, right? Keep them in a room, keep it clean, you know, that you can clean easily. Most people even don't want to do that, but at the very least, keep them out of the bedroom, right? And that's the key, I think, with all of these allergens, right? Have a safe sleep space, because we spend 8, 9, 10 hours a day in our bedrooms. If we can keep the allergens either down that are found there or outside, keep them from getting into the bedroom, it can really have a dramatic effect on our symptoms. Right?
Absolutely. Yep.
We have another question too. When it comes to an allergic reaction, what about delayed allergic reactions, type 1 or type 2?
Yeah, I mean,
Go ahead.
so, you know, I think we often think about, you know, allergies, immediate symptoms, right? If, you know, you get stung by a bee, you have immediate symptoms. You know, you get exposed to pollen and you're allergic to pollen, you have immediate symptoms. But there's actually 2 phases of a reaction. So we can actually have delayed symptoms, or we can have immediate symptoms and then kind of a second phase come on. Where those symptoms come back hours later.
Yeah.
You know, it's probably a little more involved than we want to get into today, but there are even, you know, there's types of food allergy that are actually, you know, that are really delayed food allergy, and that's a whole topic for a whole nother show.
Yeah.
We have another question right here. How can patients better advocate for themselves to get tested for allergies in primary care?
Yeah, that's a great question, and that's a fantastic question. I would say that you can advocate for yourself to get tested by being knowledgeable about the conversation we're having here today. You know now what rhinitis is. You know that there are 2 different camps that start out with, the allergic camp and the non-allergic camp. And so and you also know that if you're taking antihistamines and it's not solving the problem for you, then all of those things, when you go in to speak to your primary care, you can ask for that specific delineation between which camp am I really in, and why are my medications not working, and then when they test you and get that information for what it is that you're allergic to, or if you're not allergic, then you can hone down more distinctly on what the actual diagnosis is. So how can you advertise?
You know, Scott,
Yeah.
and so I'm just thinking myself, right? I go to see my clinician. I've always got all these things I'm going to ask them, right?
Right, sure.
And then I forget.
Yeah.
Right. You know, you get busy. They're in a bit of a hurry. So sometimes just writing down exactly what you're going to cover.
That's
right?
what I was
So you
going to
don't
say.
forget.
Yeah, you want to. Some of the things that we discussed today, you know, you can watch this again, and you can write those things down of what it is, the actual questions that you want to have for your primary care provider when you go in there. Absolutely.
Excellent.
Yeah, so on the topic of non-allergic and allergic, can you talk a little bit about like a reaction to jewelry or metal? Because it seems like it's non-allergic, but it causes rashes. Can you talk on that a bit?
Sure, absolutely. So when you're thinking about the different reactions that you can have, the allergic rhinitis is caused by what's called IgE. That's just one of those immunoglobulins that are out there. I'm sure during COVID, most folks have heard of IgG and IgM. Well, IgE is for allergies. When you're talking about allergies, or what people would call an allergy to skin, or to, like, say, some nickel jewelry, where you get, like, maybe if I had a necklace on and it was causing a little bit of red area where that necklace was sitting, that's not really an allergy that's caused the same way as with the IgE mediated or an allergy that's caused by IgE. That's really just a contact dermatitis.
Yeah.
So it's a whole different.
And to your
different
previous
allergy.
question, Luke, I mean that is usually a delayed allergy. So that's what we call a type 4 hypersensitivity reaction, and it usually happens, you know, hours after. It doesn't happen immediately on contact with the metal.
Yeah. Very good. Yeah.
And we're going to end on one last question. Is it possible to react to non-allergic and allergic triggers at the same time?
Yeah.
And what do you do in a situation like that?
Yeah, great question. And you would do the same thing that you would do if you were reacting to either one of them individually. And that is, knowledge is power. Knowing what it is that you're allergic to, it can add inflammation. And then knowing what it is you're exposed to for the non-allergic side, because it could be pollution, it could be all kinds of things. And once you add those 2 together, just like I was talking about on the floor, adding things up cumulatively to reach your symptomatic threshold, some of those could be allergic, some of those could be non-allergic, and it all builds up. to cause inflammation in your nasal airway.
Excellent.
Yep.
Scott, this has been a fun and an informative session. I certainly
Absolutely.
appreciate you joining us today.
I appreciate you having me.
You know, thank you all for joining us live from the Quad AI. You know, spring allergy season is here, especially in the South, and I think I think everybody in the North is hoping it's going to get here pretty soon. But we want to ensure that you're feeling well and you're prepared with all the resources and tips you need, easy to digest information on Allergy Insider. So, you know, be sure to check out the latest blog on the topic. There's a blog out there. You can just click the link in the bio. Scott, you know, thank you so much for joining us today.
Yeah.
I think we're just going to we're gonna close by saying, you know, I think repeating your statement because I loved it, right?
Yeah.
Knowledge is power.
Knowledge is power.
And once we know what the possibilities are, then we can fine tune and we can actually address. You know, preventative medicine is a big, you know, buzzword these days, but it's the truth. We want to get at the root of problems, not just put medications on them. Although medications are needed. as well.
Medications can be needed sometimes. Let me just add to that to say that you know, rather than beat down your symptoms with meds, rather than beat them down, find out what's causing the problem, and you can find out what's causing the underlying problem, and that really helps out quite a bit.
Awesome. Thanks again. So as always, stay tuned for our next episode of Ask the Insider. If you don't already, follow us on Instagram, like our page on Facebook for more information from Allergy Insider. It's your go-to for medically relevant resources of all things allergy.
All right.
We'll see you soon.
Take care, y'all.